The next MS study is a study about personalized extended dosing of Natalizumab. Natalizumab is a very effective therapy for patients with relapsing-remitting MS. However, in 85% of patients, Natalizumab drug concentrations are still very high in the standard treatment interval of every 4 weeks. Several research groups studied extended interval dosing, and they found equally effective suppression of disease activity compared to standard interval dosing, so when the treatment intervals are extended with longer amount of weeks between infusions. But the Natalizumab drug concentrations, they also vary widely between patients, so a personalized approach might be superior to fixed extended intervals. And therefore the aim of the next MS study is to study personalized extended interval dosing based on those trough concentrations. So it's a national multi-center prospective study in which patients with relapsing-remitting MS can participate in 3 different study groups. A study group with an aim trough concentration of 5 micrograms per milliliter, an aim of 10 micrograms per milliliter, and a standard interval dosing group. And the treatment intervals are then determined after 2 consecutive measures of the Natalizumab drug concentrations, and the additional weeks are then added to the current treatment interval. The primary outcome of the study is radiological disease activity defined by new or enlarged lesions on MRI. So the preliminary results of our study show that in the EID5 group, the majority of patients can extend to a 6-week interval between infusions, but about 1/3 of patients can even extend beyond 6 weeks, so 7 to 9 weeks, and some even up to 9 weeks. And in the EID10 group, the majority of patients can extend to 5 weeks between infusions, and up until now we do not see any differences in radiological and clinical disease activity. And there were also no cases of PML, so potential complications. We think that this is a potential way to implement personalized dosing into clinical care.